Hello, today we are going to discuss exercise prescription and progression. We will discuss what an exercise prescription is, what factors are considered when developing an exercise prescription, and when and how to safely progress an exercise program. An exercise prescription outlines a program designed to improve your health and well-being. Your customized exercise prescription is developed by your exercise therapist and designed with your preferences and goals in mind. Exercise prescriptions should be reviewed regularly and adjusted as necessary. Factors that are considered when prescribing exercise are medical history, your cardiovascular history, any musculoskeletal history, including injuries, conditions, or limitations, using fitness assessment results if they are available to see what your current fitness level is. Also looking at your current fitness and activity level, looking at your exercise goals and preferences. Also includes any equipment that you may have available to you. It is important when we're exercising that we are able to monitor our intensity. There are several tools that we can use to monitor the intensity of the exercise. The first one is the rating of perceived exertion. It's a subjective scale where we are assessing our inner feeling of exertion during that particular exercise. The rating of perceived exertion scale starts at 6 and ends at 20. So 6 being effortless, so sitting on a chair. Getting into the 7 or 8, something feeling very light would be going for a stroll, something easy where we can sing, etc. A little more intensity would be something we would consider warm-up, something feeling fairly light, so that 10 to 11 zone. For cardiovascular exercise, so something that we're going to be doing for a prolonged period of time, we want to be within the 12, 13 to 14 range. So the RPE of 12, 13, or 14 on the scale, maybe verging on 15. If your cardiovascular exercise is feeling like a 15 or higher, then we would want to adjust the exercise prescription at that time, as it is too hard. For resistance training, however, we would want to feel like a number 15. We do want resistance training to feel hard. Examples of exercise feeling very hard, if you have had an exercise stress test, you might have felt like that was a 17, 18, or 19, or maybe even maximal effort. So again, for cardiovascular exercise, we want to be about middle range, 12, 13, or 14. Another tool we can use to monitor your exercise intensity is monitoring your heart rate. There are many different ways we can monitor our heart rate. We can monitor by palpating at the carotid artery in the neck or the radial artery in the wrist. Another tool is the pulse oximeter that is placed on the fingertip, which will give you your heart rate in beats per minute. We may have a smartphone that can monitor our heart rate as well in beats per minute, or we might have a smartwatch that can monitor the heart rate in beats per minute. Using the heart rate as for monitoring our exercise intensity would be used if we had information from an exercise stress test where we could develop our target heart rate zone, or we can use the heart rate as a relative measure in combining it with our effort level. When should I progress my exercise? How do we know if we are ready to progress our exercise? If our rating of perceived exertion, the RPE, if it's consistently below 11, or it feels fairly light or very light, that would indicate that we're ready for a progression. If our exercise heart rate is consistently below our target heart rate range, then we know we are ready for a progression of the exercise. And if our goal is to improve our fitness level, then we know that we are ready to progress our exercise. When do we not progress our exercise? If our rating of perceived exertion is above 15. So if your exercise is feeling hard and it's not getting easier, we are not ready to progress, and we may want to discuss with our exercise therapist our exercise prescription at that point. If your exercise heart rate is higher than your target heart rate range, we would also not progress at this time. If you're experiencing any symptoms, that is not a time where we would progress our exercise. If we've had any recent medication change, we would not want to progress our exercise at this time, because medication changes can change how we're feeling, can change our heart rate, our blood pressure. So we would wait until our body gets used to the medication before we're ready to progress. If we're acclimatizing to a new environment, we would not progress our exercise at that time. We would give ourselves some time in the new environment before we're ready to progress. And if our goal is to maintain our current level of fitness, we would not progress our exercise at that time. The important note for this is that we don't always have to be progressing our exercise. We don't have to be progressing every week or every 2 weeks or every 3 weeks. It depends on the factors that we just discussed. How to progress a walking program. There's many factors that we can alter to progress our walking program, and it's important to note that only one factor should be adjusted at the same time. The first thing we can do is increase our duration or distance when we've started our walking program, and our goal is to aim for 150 to 300 minutes of moderate to vigorous aerobic exercise or cardiovascular exercise each week. Once we have achieved that, the next step would be to increase the speed, which is increasing the intensity of the walking. The next step, what we could do is alter our terrain. So we could include hills on our walking route. If we're walking on a treadmill, we could increase the incline on the treadmill. Later on in the program, as you get more fit, you can think of cross-training, which includes a variety of exercise modes. For example, using the elliptical trainer, stationary bike, swimming, etc. Again, it's important to note that only one factor should be adjusted at a time. Okay, we want to test your knowledge. Which of the following statements is incorrect? A, the RPE scale is a tool that can be used to measure exercise intensity. B, adjusting your walking route to include hills is an example of an exercise progression. C, your exercise prescription should be adjusted every 2 to 3 weeks. Or D, an RPE of below 11 may indicate your exercise program should be progressed. The correct answer is C. Your exercise prescription should be adjusted every 2 to 3 weeks. This is incorrect. As I mentioned before, there's many factors that must be considered before we progress our exercise, and sometimes we will be maintaining our exercise over a period of several weeks. Okay, when we look at reflecting over the last week, if you're working towards a particular goal in the program or over the last week, we want to reflect on what went well with your goal setting over the week. Is there something that we can do differently? And your exercise therapist would ask, how can we support you in your goals? For more information, please speak with your exercise therapist. Visit our website at gethearthealthy.ca, and you can view the calendar of live events on the website.